Assalamu alaikum.
عليكم السلام ورحمة الله
How are you
وبركاته.
today, my friend?
الحمد لله الحمد لله doing
Hoe
well.
gaat het met jou?
Gaat goed.
Or I can say, wie geht's dir?
Gaat goed.
Gaat goed.
Good.
كيف
Gaat
حال؟
good.
كيف حال يا صديقي؟
الحمد لله
الحمد لله.
الحمد
عامل
لله
ايه؟ ازيك؟
الحمد لله. I'm happy
ازيك؟
to be here.
الحمد لله.
Thank you for the invitation.
So I'm dr.psychiater and this is my beloved friend Aus. Aus is currently studying medicine in Groningen. We are right now in the city of Groningen. Can you move a little bit more into the picture?
Yes. Looks
You're
good.
quite small compared to me. Anyway, today we just want to tell you a little bit about our stories and compare how it was for me to study medicine in Germany as a German, and for us the story is quite different, how he studied medicine in Groningen in the Netherlands as a Saudi student, as a Saudi man. So where exactly are you at in the study right now?
I finished. I'm in my 5th year.
Yes.
Here in the Netherlands, it's separated into bachelors and masters.
Yeah, exactly.
So 3 years bachelors and 3 years masters. And I'm sitting at the moment in the 5th year, in the middle of the 5th year.
Okay, nice.
Which is basically like internships in different departments in the hospital.
And I heard you're doing cardiology now.
I just finished cardiology. Alhamdulillah.
And how was it?
It was nice. I came into cardiology with, like having the old thought that you're only seeing like old patients and they're chronically ill patients. But for me, it wasn't like this. It was more like usually you see like patients around the 40s, 50s, and 60s. And through my experience, I didn't think that they're really old. I thought they're, like middle-aged men. But subhanallah, like they had an issue, like a shocking issue, usually, of having like heart problems.
Mm-hmm.
Sometimes it's more severe, sometimes it's less severe. But I didn't have the idea that like they're old and like it's part of life. No, like they had like an issue that they really need help with.
Okay.
So alhamdulillah, like for me also, like for a student, it was nice to deal with these patients and try to help them.
Okay, so you had a good time.
Alhamdulillah.
You felt good in your position as a student to see something what might be a future position of a doctor and to learn something.
Yeah.
Okay.
Alhamdulillah.
So to jump right into the more interesting, if I can say, or more into a spot where we can see the differences of studying as a German in Germany or a Saudi in Netherlands, I want to ask you the question, what was the hardest part about studying as a Saudi in the Netherlands?
In the beginning, it wasn't really difficult. You start, like there are differences between Saudi and, like Western countries like the Netherlands. But it wasn't really something that you need time to adapt to. Later on, as further as you go, and as more when you grow up and realize that like religion is a very important part of your life, and it is so, you realize that there are like limitations to what you can do in compared to this society.
Okay.
Sometimes like you feel pressured that you can't keep these limitations, and that was the most difficult part for me.
So keeping your religion.
Exactly, and it's not I can give you an example. For example, shaking hands with women, for example. Like, this is the most basic example I can give. Like, we know that we're not allowed to do that, but sometimes you have, like, people approach you and then want to shake hands, and it's from a respectful manner, not in any other way. But you have to, or at least that there are limitations here, that you shouldn't do that.
I understand this. So you also had a kind of culture shock when you arrived?
When I arrived, not really, no.
Not really?
No.
You have been to any other Western country before?
I've been to the States to visit.
Yes.
For a summer. And I mean, from movies, from TV, we know how's the lifestyle in the Western countries.
Okay.
So it was not
a shock, but
no.
You had to learn how you will find your own limits by the example of shaking the hand of the women.
Yeah.
And I guess by other things as well.
Exactly.
And another question, like, about the study itself, like, if we want to compare that I studied medicine in Germany as a German student, and you studied medicine in the Netherlands as a Saudi, as a foreigner, let's say, because I guess it's not your mother tongue. Your mother tongue is, I guess, Arabic.
That's true.
Then you speak English. Now I heard you speak Dutch.
Yeah.
So apart from the culture, like the study itself, medicine, and then the language, what was your hardest time in the study itself?
I mean, the hardest time in my study is that I had to take a gap year, and it was actually, like, eventually turned out to be 2 years to really study the language in order to continue.
Dutch?
Yes. So the first 3 years you can study it in English.
The bachelor?
Yes.
Okay.
And then for the masters you need to speak the language.
Okay.
You need to have a high level in order to continue, because from the first year masters, which is the 4th year, you're gonna go into internships, and you're gonna meet patients, and you're gonna have to talk with patients and take their history and deal with them, like the first steps of becoming a doctor.
Okay.
And they don't allow you to speak with them in English. Okay. Although, mashallah, here in the Netherlands, almost everyone speaks English. And regardless of the age, like very young people, they speak English, up to people in the 70s, 80s, 80-year-olds, they speak good English. But for the convenience of the patient, you have to speak their language.
Okay.
So that was the most difficult part, is that I had to stop in order to get the level, and then to continue.
Okay, so they allow you first, the bachelor, to study it in English. And did you speak English before you arrived?
I was speaking English.
And did you have to show a language certificate?
Yes, you have to make an IELTS exam. You have to take 5.5 IELTS level, and that's for the first year, and then it has to be like 6.5.
Okay.
To enter the medical school, because we have like a pre-university program. You can enter it with 5.5, and then 6.5 for the medical school.
And you did the pre-university year also here in Groningen?
Yes.
And
yes.
It was not medicine, it was something else.
It was more biology. You learn a little bit Dutch, and you learn a little bit how to deal in this culture.
This is mandatory, or it's
yes.
optional?
No. You have to.
For foreigners?
Yeah.
Also for students who come from the EU?
No.
Only for outside EU students?
Exactly.
Okay.
Because I think there are some subjects that we don't take in high school, or maybe it's in a different level. So in that year we take this extra subject.
Okay.
And to be able to to enter the university.
And the Dutch and the EU students, how much do they pay per year or per semester for the study fee?
For the Dutch, they pay 2,000 euros per year, and I think normally it's higher than this, but they get subsidized by the government, so they end up paying 2,000 euros per year. But for a non-EU citizen, you pay 32,000 euros per year.
Per year?
Per year.
Wow, that's a big number. I had in mind 10,000.
No.
Okay.
32.
Okay, that's actually quite a big number.
That's, yeah.
Okay, so Dutch people and EU citizens, 2,000?
Yeah.
Outside EU, 32.
32.
Okay.
Yeah.
And how did you manage to finance your study?
We get scholarships from the Saudi government,
Okay.
alhamdulillah, and they cover the study fees.
Okay.
And you just basically have to you have to finish your studies, and
they
yeah,
also pay some amount of money for your living?
per month.
Okay.
Yeah.
And you can manage?
Alhamdulillah.
Okay.
Alhamdulillah.
And I guess in USA and England it can be even more expensive, I guess. To study medicine.
Study medicine.
Or
Yeah.
it's similar.
I don't know, to be honest.
Mm-hmm.
I don't know that.
Okay. Yeah, so this is already, we see some differences, I guess, between my case and your case, that, for example, I didn't have to learn any other language rather than German for my study in Germany. It was in my mother tongue. It's as if you would have studied in Saudi, for example, or in an Arab-speaking country where they would have taught you medicine in Arabic. Would be the easiest.
Yeah.
And for me, we only had to pay 400 euro per semester.
Okay.
So it's
even cheaper.
Yeah, it's a big law of the German government that they try to keep all the education, the governmental education, for free. It should actually be for free, but the 400, it's partly for public transportation ticket, which will be included in your university ID card, and then you pay like this other 200 euro for some service fees. And I mean, if we hear this other numbers now from other countries, it's 200 is nothing.
No.
Still, some students in Germany, they complain about this 400, but yeah, if you compare it to other cases, it's really nothing.
No. And also in Saudi, I know this. You can study also in Saudi medicine, and basically all the studies in Saudi is for free, basically.
Okay, and how was your decision not to study in Saudi? Was this also an option?
Yes, it was an option, and honestly, I started with it. I enrolled myself in a university in Mecca, and I started the first year.
For medicine?
For medicine.
Okay, good.
And I was commuting from Jeddah because that's where we live, and I was commuting every day from Jeddah to Mecca. And it's almost like one hour ride. I mean, to get to Mecca, to get to Mecca is 45 minutes, and then to get to the university, that's another 10-15 minutes. And halfway through, I felt like I didn't like this commuting, and because I had good grades in high school, I can apply for a scholarship. And then I thought about it, and I liked the idea of going for a scholarship. And I applied with it, and then made istikhara, and alhamdulillah I got accepted. And after that I came out. I left.
So for the non-Muslim audience, you just use the Islamic term istikhara, and you maybe explain what it means?
Istikhara, it's
to put it in simple words.
In simple words, when you have to make a decision that you don't know what's best for you, or you don't know if it's good or not, and you have more than one option, then there is this prayer that you pray, and then you make a dua, and that's
what is dua?
What is dua?
it's a prayer.
It's also like a prayer, and you ask God to show you which is right. And the idea is that you think yourself of what you think is the best, and then you make this prayer, and you try to follow what you decided for.
Okay.
And if it goes smoothly, if it goes well, then that's the best thing for you. If the doors get locked, if you face troubles like following it, then that's most likely that it's not the best option for you.
Okay, so you made istikhara, and then you made your decision that you want to go abroad.
Yeah.
And what was appealing for you to go abroad?
I think one of the main things is that the commuting, it was always like it was always troubling for me, because it was always like very busy. The streets are very busy, like you have to wait. There are many cars, there are many traffic, and that's mainly one of the things that I actually wanted to get out of.
But then you would have had the possibility to live in Mecca. You could have
Yes.
rented
Yes, but I thought also like I have the chance to go outside and to see something new.
So you wanted to explore another part of the world, if I
Yes.
can say.
Yeah, exactly.
And as we all know, like, it's a great chance to get to know yourself, to get to know other cultures. There's a lot in it to travel.
Yeah, you're more independent, and you're more free to make your own choices, and to live your own adventures, to live your own
Yeah, for me, I didn't travel as far as you did in my life, but also for me, traveling, it always showed me better who I am really and what I want, rather than staying at home. Then you are like in the comfort zone, and you don't really develop that much.
That's true. That's true.
And about the quality of study, is this also part of the reason that the quality in other countries is different than in Saudi, or this was not a reason in your decision?
I didn't really think a lot about it.
Okay.
Like I didn't know how's the quality of studies in the Netherlands. I didn't really think about it from this way. Okay. But you always kind of have this idea that like studying abroad is better than studying home. Although, is this really true or not?
We will discover.
Yes.
It might be individual. Like, I guess as usually for these answers, like for some people it will be better to stay home, and for some people it's how can I say, there's more enrichment, more possibilities if they would have traveled.
That's true. That's true. Yeah.
So for now we have to close it, because we have another event that we will join now, and so we can summarize already for what we have heard so far from ours, that it's quite a challenge to study in another country if you have to especially learn a third language. Like, he, as a Arabic native, he had to travel to the Netherlands and not only improve his English, but also learn Dutch. So keep that in mind if you think about studying in another country. Of course, English might be the easiest, and then a third language can be really tough. That's what I heard from Aus so far, and of course I know him in his private life as a friend, and I saw how he was challenged. But Yani, this is what also made you strong, and I guess the challenges can be helping us. But for the audience who might watch this is interesting to know. And for myself, as I said, as a comparison, there was not these kinds of challenges, but as we will continue in the second part, we can also talk about the actual medical content and how this also was a struggle for both of us. And this is maybe what more is a common thing for us, but the language is an extra thing, for example, for the foreigners. So I'm happy for this awesome talk,
Thank you.
and we will see each other in the next round.
Inshallah.
Inshallah.
Yeah. Thank you for having me.